Now streaming from Meetings by Mail, Cleveland Clinic's Multispecialty Pathology Symposium. Worth 16.75 AMA-PRA Category 1 credits, applicable towards American Board of Pathology continuing certification requirements. This activity features an expert faculty addressing commonly encountered pathology problems and providing practical tips from their own experience at the microscope. A broad spectrum of cases will be presented, reviewing genitourinary, pulmonary, gastrointestinal, soft tissue, gynecologic, and breast pathology. More specific topics include renal cell tumors, prostate cancer, IBD, ulcerative colitis, lung cancer updates, thoracic pathology, mesothelioma, thymoma, endometrial cancer, squamous cell carcinoma, problematic lesions, neoplasms of the breast, and much more. Let's take a closer look.
All right, but take all of those things with a grain of salt. This is another myoinvasive tumor, and it's looking pretty bad at this myoinvasive front. And one of the things that I initially find is that there's a bunch of large vessels that are involved, right? And these are somewhat papillary and molded to the shape of the vessel, but they also have a little bit of junk and maybe some fibrin and inflammatory cells mixed in there. And when I see just large vessels involved, I always pause and say, oh, this could be contamination, right? But in cases where this large vessel LVI might be real, you can usually find that small vessel LVI to help support it. And so here's a few small areas that are closer to the myoinvasive front that help me say, yeah, this is probably legit.
Dig deep with the finest minds in pathology. Cleveland Clinic Multispecialty Pathology Symposium is available now at meetingsbymail.com.